One of my patients once told me, "Doctor, I only noticed my ankles were swollen, and my feet felt cold." A few weeks later, he learned that his heart was already struggling. Have you ever noticed unusual swelling in your legs, persistent cold feet, or a heavy weighed-down feeling in your lower legs? If so, don't brush it off as normal. Recognizing these signs early can change the course of your future. One morning, you step out of bed, and suddenly your legs feel heavier than usual. Many people think, "This must be old age." But small changes in your legs and feet can be early signs of congestive heart failure beginning silently. Below are 12 scientifically proven warning signs of heart failure, and we begin with the first. Sign number 1. Feet that are always unusually cold. This is a sensation many older adults experience and often ignore. Your feet feel cold all the time, even when the rest of your body feels fine. You wear thick socks, walk around the house, even try moving more, yet your feet stay cold. Many people reassure themselves it's just my age or it's the weather. But in reality, when the heart begins to weaken, it is forced to prioritize the limited blood flow it has, sending it first to the brain, the heart itself, and the lungs. The feet, being the farthest point from the heart, are often the first place circulation is reduced. If your feet remain cold and do not warm up with rest or movement, this may be an early warning signal your heart is quietly sending. Sign number 2. Pitting, edema, indentation, swelling. This is a subtle but extremely important sign. Look at your ankles or lower legs. Press firmly with your finger for a few seconds, then release. If a dent remains and does not spring back right away, this is not normal swelling. Many people assume leg swelling comes from standing or walking too much. But when the heart becomes weaker, it cannot pump blood efficiently back to the lungs. Blood begins to pool in the veins, increasing pressure. That pressure forces fluid out of the blood vessels and into the surrounding tissues of the legs. This is one of the ways your heart is signaling distress. Sign 3. Sudden weakness in the legs. You've climbed the same set of stairs for years, but today, after just a few steps, your legs suddenly feel weak. Many patients describe it this way. My legs feel soft, like they're made of noodles. Most people blame aging or inactivity, but medically speaking, this can be a sign your heart is struggling. When the heart cannot pump enough blood, the leg muscles, the largest muscle group in the body, do not receive enough oxygen and nutrients. Over time, muscle structure changes and strength declines. One patient told me that after only a short walk, his legs began to tremble and he had to stop. If tasks that were once easy suddenly feel difficult, your heart may be quietly asking for help. Sign number 4. Rapid weight gain from fluid retention. One morning you step on the scale and feel shocked. In just a few days, your weight has jumped by 10, even 20 pounds. You haven't been eating more. Your routine hasn't changed, yet your pants feel tighter and your shoes suddenly feel snug. This isn't fat. It's very likely fluid being trapped inside your body. When the heart weakens, it can no longer pump blood effectively or move fluid where it belongs. The body is forced to retain water, and due to gravity, that excess fluid settles in the legs. One patient once told me I thought I was gaining weight because I was eating well, but it turned out it was my heart. According to research from the Mayo Clinic, rapid weight gain caused by fluid retention is a medical red flag and should be evaluated immediately. Sign number 5. Bluish or darkened skin on the legs. Cyanosis. You may notice that the skin on your legs no longer looks healthy and pink. Instead, it appears bluish or unusually dark. Many people assume this is just due to cold weather or temporary poor circulation. But this can be a very serious sign known as cyanosis. When the heart can no longer push blood efficiently throughout the body, oxygen-poor blood begins to pool, especially in lower areas like the feet and lower legs. That's why the color change often starts in the toes, then gradually moves up toward the ankles and calves. One patient told me I noticed my toes getting darker, but since there was no pain, I ignored it. In reality, this is when the tissues are experiencing severe oxygen deprivation. That change in skin color is a clear warning that the heart is under serious strain. Sign number 6, persistent ankle swelling. This is a sign so common that many people accept it as normal. Your ankles look fine in the morning, but by late afternoon or evening, they become swollen tight and heavy. The skin appears shiny, and pressing on it feels uncomfortable. You try resting, elevating your legs, waiting, but the swelling doesn't fully go away. As the heart weakens, blood begins to back up in the veins. Rising pressure pushes fluid out into the surrounding tissues and gravity pulls it down to the ankles. One patient told me every evening my legs were noticeably bigger than in the morning. This is a very classic sign of heart failure. If it happens day after day, your body is telling you that your heart needs serious attention. Before we continue, if you're finding this video helpful, please tap the like button so more older adults can see it and subscribe to the channel. We share new senior health tips every day, and you won't want to miss the next video. Sign number 7. Wounds on the legs that heal very slowly. A small scratch on your lower leg or foot should heal within days. It doesn't hurt much. It doesn't bleed much. But instead of healing, it lingers sometimes for weeks or even months. When the heart cannot pump enough blood oxygen and nutrients fail to reach the tissues that need them, circulation slows, the immune system weakens, and the body struggles to repair even minor injuries. One patient once said to me, "It was just a tiny scratch, but it never seemed to heal." That slow healing wound is a sign that the tissues in your legs may be suffering from chronic oxygen deprivation. And deep inside, it may be telling you that your heart is having difficulty sustaining your body. Sign number 8, leg pain or cramping. While walking, claudication. You've only been walking for a few minutes, yet your calves begin to ache, feel tight, or even cramp, forcing you to stop and rest. When you stand still, the pain eases. When you start walking again, it comes right back. Many people assume this is due to joint problems, aging, or a lack of calcium. But from a medical standpoint, this may be claudication, a sign that the heart is no longer able to pump enough blood to meet the body's needs, even during light activity. When you walk, your leg muscles require more oxygen. If the heart is weak, blood cannot reach them fast enough, and pain develops. One patient once told me I was just walking to the mailbox, and my leg started stabbing with pain. If this happens repeatedly, it is not a minor issue. It is a warning from the heart. Sign number 9, restless legs at night, seen in 78% of patients. This is a symptom many people experience at night, yet rarely connect to the heart. You lie down, turn off the lights, hoping to sleep peacefully, and suddenly your legs begin to feel itchy, crawling, twitchy, or unbearably restless. You feel compelled to move them constantly. The more you try to stay still, the stronger the sensation becomes. Statistics show that about 78% of heart failure patients experience this condition. During the day, poor circulation causes fluid to pool in the legs while you sit or stand. At night, when you lie down, that fluid redistributes back into the body, compressing nerves and disrupting sensory signals. One patient told me I was exhausted, but I couldn't sleep because my legs wouldn't stop moving. This is the heart's warning delivered in the quietest hours of the night. Sign number 10. Rapid worsening of varicose veins. Some people live with mild varicose veins for many years. But then, over a short period of time, the veins in the legs suddenly become larger, more twisted, more visible, heavier, and painful, with new veins appearing quickly. Many assume this is simply aging or spending more time on their feet. But when the heart weakens, it can no longer effectively pull blood back in the proper direction. Pressure backs up from the heart into the leg veins, causing blood to pool. The vein valves fail more rapidly, and varicose veins can worsen dramatically. When varicose veins deteriorate this quickly, it may be a sign that the heart is facing a serious problem. Sign 11. Tight, shiny, fragile skin on the legs. The skin on your legs no longer looks the way it used to. It becomes tight, shiny, and unnaturally smooth, almost losing its natural wrinkles. When you touch it, the skin feels thinner, more fragile, easily scratched or bruised. Even a light bump leaves a mark. Some people think their skin looks better in a strange way, but this is not a healthy sign. When the body retains fluid chronically due to poor heart function, fluid accumulates in the tissues beneath the skin. The skin is stretched continuously like a balloon that has been overinflated. One patient told me, "My leg skin looks shiny, but it feels weak." This is a quiet reminder that fluid balance inside the body has been disrupted, reflecting a silent burden the heart is struggling to carry. Sign number 12. Numbness or tingling in the feet. Your feet may begin to feel numb, tingly, or like pins and needles. Sometimes the sensation is mild. Other times it becomes strong enough to feel uncomfortable. At first it comes and goes, so many people ignore it. But over time, the numbness may last longer, spread further, and make your steps feel unsteady. When the heart weakens, fluid builds up in the legs and compresses small nerves. At the same time, blood flow carrying oxygen to those nerves is reduced. This lack of oxygen creates sensations of numbness, tingling, or burning. One patient once told me, "I can no longer clearly feel the ground beneath my feet." This is dangerous. Loss of sensation means loss of balance, increasing the risk of slips and falls. Numbness in the feet may be a warning that the heart is growing weaker. How many of these signs do you have? How many of these symptoms apply to you? If you have 2 or 3 or more, this is no longer a coincidence. When your legs swell, your weight increases rapidly. Without explanation, your feet stay cold and your body feels constantly fatigued. Your body is sending multiple signals at the same time, especially if you have slow-healing wounds on your legs or notice changes in skin color, such as darkening or a bluish tint. This is not the time to wait. Your legs and feet are an early warning system for your heart. Your legs and feet do not swell, feel cold, change color, or grow weak without a reason. They are the body's early warning system, signaling that the heart may be struggling. Heart failure is not the end. When detected early, many people continue to live healthy lives, stay active, and enjoy many quality years with their families. Early treatment helps delay serious complications, preserve independence, and bring peace of mind to daily life. Please tap like, subscribe, and share this video. Doing so helps YouTube show it to parents, friends, and others who may desperately need to hear this message. Thank you for watching.